Viruses are microscopic infectious agents that can cause a wide range of illnesses in humans and animals. Among these, arboviruses, arenaviruses, and filoviruses represent three important groups of viruses that primarily spread from animals to humans, and in some cases, from person to person. Understanding these viruses is crucial because they can cause diseases ranging from mild flu-like symptoms to severe, life-threatening conditions such as hemorrhagic fevers. Let's begin with an overview of what distinguishes each group. Arboviruses, as their name suggests, are arthropod-borne viruses. This means they are transmitted to humans and other animals by blood-feeding arthropods, such as mosquitoes, ticks, sandflies, and midges. There are over 250 different arboviruses, with at least 80 known to cause disease in people. Some well-known arbovirus-related diseases include dengue, yellow fever, West Nile virus infection, and Zika virus infection. Most arboviruses are carried by mosquitoes, but some are spread by ticks, and a few by other insects. Most arbovirus infections do not result in noticeable symptoms. However, when symptoms do occur, they are often mild and resemble those of the flu: fever, fatigue, and muscle aches. As the infection progresses, some people may develop additional symptoms such as swollen lymph nodes, rashes, and joint pain. In more severe cases, the viruses can infect the protective tissues around the brain and spinal cord, causing meningitis or the brain itself, resulting in encephalitis. Certain arboviruses can also cause hemorrhagic fever, a serious condition characterized by fever and an increased tendency to bleed, which can be fatal. The transmission of arboviruses typically requires an infected arthropod to bite an animal or human, and then bite another host, passing on the virus. In most cases, direct transmission from person to person is rare, largely because the concentration of virus in human blood is not sufficient to infect the arthropod vector. However, there are notable exceptions. Dengue, yellow fever, and Zika virus infections, for example, can be spread from person to person by mosquitoes. Zika virus is unique in that it can also be transmitted through sexual contact, and all three, dengue, chikungunya, and Zika, have, in rare cases, been transmitted by blood transfusion, organ donation, or from mother to newborn during birth. In recent years, arboviruses have been spreading to new areas, in part due to climate change, which has expanded the habitats of mosquito species that carry these viruses. Increased global travel also plays a role, as infected travelers can introduce viruses to new regions. For instance, chikungunya, once confined to Africa, has now spread to the Caribbean, Central, South, and North America. This virus is mainly transmitted by Aedes mosquitoes and is known for causing fever and severe joint pain, particularly in the hands and feet. While most people recover within a week, joint pain can persist for months or even years. In response to the growing threat, the U.S. Food and Drug Administration, FDA, approved the first chikungunya vaccine in 2023, targeting adults at increased risk due to travel or occupational exposure. Arenaviruses form another significant group of viruses, but unlike arboviruses, they are primarily spread by rodents. Humans typically become infected through contact with rodent urine, feces, saliva, or nesting materials, or by inhaling dust contaminated with these substances. Some arenaviruses, such as those causing Lassa fever, Bolivian hemorrhagic fever, Venezuelan hemorrhagic fever, and Argentine hemorrhagic fever, are known for causing severe disease. While many arenavirus infections are relatively common in certain parts of the world, the severity can vary. Lassa fever, for example, is prevalent in West Africa and can also be transmitted from person to person through contact with body fluids. This can lead to outbreaks, especially in healthcare settings where proper precautions are not observed. The arenavirus lymphocytic choriomeningitis virus, LCMV, is another example. It can cause meningitis and is often linked to pet rodents or wild mice. While most infected people experience mild symptoms or recover fully, certain arenaviruses can cause severe hemorrhagic fevers, similar to those caused by filoviruses. Filoviruses represent a particularly dangerous group, known for causing severe hemorrhagic fevers with high mortality rates. The most infamous examples are the Ebola and Marburg viruses. These viruses are typically transmitted to humans from infected animals, often thought to be fruit bats or non-human primates, and can then be spread from person to person through direct contact with blood, secretions, or other bodily fluids of infected individuals. Filovirus outbreaks, especially those involving Ebola, have made headlines due to their rapid spread, high fatality rates, and the extreme measures required for containment. Symptoms of filovirus infection often begin with sudden fever, muscle pain, and fatigue, progressing rapidly to vomiting, diarrhea, rash, and impaired kidney and liver function. In severe cases, internal and external bleeding can occur. Because these viruses are highly contagious in healthcare settings, strict infection control measures are critical to prevent outbreaks. Across all three virus groups, diagnosis, treatment, and prevention vary depending on the specific virus involved. Diagnosis often involves laboratory testing of blood or other body fluids to detect the presence of the virus. Treatment options are generally limited and primarily supportive, such as maintaining hydration, managing fever and pain, and treating complications. In some cases, such as with Lassa fever and certain types of hemorrhagic fever, antiviral medications may be helpful, but for many of these viruses, no specific treatments exist. Prevention strategies focus on reducing exposure to the vectors or reservoirs, mosquitoes, ticks, rodents, or infected animals. For arboviruses, this includes using insect repellent, wearing protective clothing, and sleeping under mosquito nets in high-risk areas. For arenaviruses, it is important to minimize contact with rodents and their excretions. For filoviruses, strict infection control procedures, especially in healthcare settings and during outbreaks, are essential. Vaccines are available for some of these viruses, such as yellow fever and, more recently, chikungunya. But for many, no vaccines exist. Public health efforts thus emphasize vector control, public education, surveillance, and rapid response to outbreaks. In summary, arboviruses, arenaviruses, and filoviruses are significant causes of infectious diseases that can range from mild to life-threatening. Their transmission, symptoms, and prevention methods depend on the specific virus and its mode of spread. As global travel and environmental changes continue to alter the landscape of infectious diseases, understanding these viruses and how to protect against them remains a critical public health priority.